Hello, everyone. Thank you for joining the Education Interventions panel at MHA's Policy Institute. I'm very excited to announce my boss and MHA's Vice President of Federal and State Advocacy, Debbi Plotnick, will be the moderator of this panel. Debbi is recognized as a national thought leader and contributing expert on a wide range of topics in behavioral health. To local, state, federal policymakers, to national legislator groups. She serves on many task forces and provides background for investigative reporters as she's regularly interviewed by media. In her role at MHA, Debbi provides leadership for grassroots and legislative advocacy across the MHA affiliate network and to national legislator groups. She coordinates efforts of the Regional Policy Council, which focuses on state-level initiatives for equal access to behavioral health care, a full continuum of treatment and services, criminal justice diversion, and the value of prevention and early intervention. Her most recent projects include working with the firearm owning community to promote mental health screening and training, and suicide prevention for adolescents and adults. Debbi holds 3 degrees from Bryn Mawr College in political science, social service, and law and social policy, and these inform her passion and perspective. She also talks about her own lived experience with depression, a family member who had mental health challenges, and her dedication to mental health and systems advocacy. It is my great pleasure to introduce to you Debbi Plotnick.
Thank you, Karen. It's so wonderful to be here and moderating this really important panel today. Education is such an important place to really dive into issues around mental health. As you know, here at Mental Health America, we have all of our programs really have our before stage 4 philosophy embedded in all of them. And we know that when we follow that philosophy of prevention for all, early intervention, especially for people at risk, integrated care and services, and recovery is a goal, then everyone does better. And nowhere is that more important than in the education arena. As we heard from our colleague Maddie Reinhardt with this screening data, we know that the incidence of depression, anxiety, feelings and thoughts of suicide, of hurting oneself, or even wanting to take one's own life have been expanding tremendously over the course of this pandemic. But what we also know, and what we've all known for many years, and we'll hear from our panel members, is that major mental health conditions almost always manifest in adolescence. And we know that when we get in there early, when we identify, and where are kids at this point in their lives? They are in school. So we know that in-school services make a huge difference to the outcomes of how kids do and keeping them in school. So let me just take a minute and just give the briefest introduction for our panel members today. We have Amy Malloy, who is the program director at our Mental Health Association of New York State. That's our MHA affiliate in New York State. And you'll hear more from Amy about how she directs the Mental Health Resource and Training Center based at our MHA in New York State. And she's also a school board member. She's on the Queensbury Union Free School District in New York. And so she comes at it with many different perspectives. She'll tell you more about how this affiliate was one of the first in the country to work very hard and get a law passed for education from K through 12 for mental health. We'll hear from Ariana Gross. And Ariana is a board member, a youth advisory board member at Sandy Hook Promise. But she also is a student herself. She is an honor roll student at the Academy of Liberal Arts at the Newtown High School in Covington, Georgia. And we will also hear from national expert Dr. Sarah Wakefield. She's a child and adolescent and forensic psychiatrist. She is the director of the Child and Adolescent Psychiatry Services and the director of medical director and medical ethics at the Texas Tech University. And it's so important to Dr. Wakefield to work with families in finding their way, in finding acceptance, in finding wellness, and in ending the school to prison pipeline. So let me just turn things over to our panelists, and I'm going to ask you to speak in this order. Amy, Ariana, and Dr. Wakefield, and tell us a little bit more about yourselves and your programs, please.
Thank you so much, Debbie, and thank you for the opportunity to be a part of this panel. It's such an important topic for us to be talking about right now. So for myself, I've been with the Mental Health Association for only about 3 years. Prior to that, I was working in suicide prevention. I'm trained as a school counselor. So this has been a really exciting opportunity for me. As the project director of the School Mental Health Resource and Training Center, I get to provide support to school counselors, administrators, teachers all across New York State. So it's been a really wonderful opportunity. The Mental Health Association in New York, as you said, is a chapter of Mental Health America. We have a long, rich history of providing support and raising awareness in communities around mental health for about 60 years. In fact, we have a member network of 26 affiliates that provide everything from peer support services to clinical services and crisis services, housing, and day programs. And they've been a really important part of our work through the Resource Center because they have been the community providers kind of on the ground in the communities, and that's helped us, I think, better reach and meet the needs of individual school districts across the state. As you said, we were the leading advocate for the mental health education law. New York was the first state in the nation to sign into law a comprehensive mental health education initiative. And we are teaching mental health to students in grades kindergarten through 12th grade. And I'm sure we'll be talking more about that later, but through the Resource Center, we provide professional development to staff, we provide resources for developing curriculum, and we provide information and support resources to families as well, because it's an important part of the conversation.
Ariana, tell us about yourself, please, and a little bit about the work that you do.
Hello, I'm Ariana Gross, and I am a part of Sandy Hook Promise through their Youth Advisory Board, but also through Jared's Heart of Success Promise Club. And in these programs, we educate youth on how they can support their peers while also building a community of people, because one of our mindsets is that we can help each other in reaching that goal of us all being better with our mental health. And so my passion for mental health has really been spiked through being a part of these organizations. I was lucky enough to be chosen to be able to speak in front of Congress on behalf of youth for mental health. And that experience was truly amazing. And being able to stand up for policies such as the Stand Up Act and getting mental health professionals in schools is something that's so important to me. Because one thing that we focus on within Safe Promise Clubs and Sandy Hook Promise is stopping violence through the channel of mental wellness and mental health, and keeping people's mental health great so that they can make the best choices possible, so they don't hurt themselves or other people, and just so that they can live the best life they possibly can, because that's something we all deserve the right to. And by going to mental health, it just allows us all to live the best lives we can and build communities that are strong enough to endure anything. So yes, thank you guys.
Dr. Wakefield?
Yes, thank you. Thanks for having me. I'm so overwhelmed by everything that you guys are doing, and know so much how much a village it takes to address mental health concerns and mental health distress. And it's so exciting to hear the things that are going on around the country and the involvement at so many different levels, from policy to groundwork within the schools. I'm a child and adolescent psychiatrist. That's how I think of myself first, I think, maybe other than a mom. But so I do have school-age children. But I'm a child and adolescent psychiatrist and a forensic psychiatrist. So I see lots and lots of kids in our area. I also see all of our kids in our long-term detention program and the juvenile justice program. And what I know for sure is that we're not intervening early enough, and that many of our children are suffering consequences of their mental health distress because of multi-generational traumas and lack of treatment for their parents, and that it is a community health issue, and that it will take all of us to work together to address. And so, but it is my commitment, my lifelong commitment, to do this work, and I feel honored and privileged to be a part of this mission.
Thank you. Thank you all. I'd like to start with some questions. I'm going to start with Ariana. Ariana, this is a really difficult time. I know it's been hard with kids being out of school, and now they're heading back to school during the pandemic. And in certain places, certainly in Georgia, there's high rates of transmission. What are you and your fellow students experiencing as you're in this period of heading back to school?
This is a great question, because I think youth today are going through one of the most unique challenges that I think history has ever seen. And one thing that I know that we're experiencing is the loneliness that comes with part of self-isolation, because I know from personal experience, a lot of, I won't be seeing a lot of my friends for a long time. I haven't seen them since about March, and I don't know when I'll be able to see them again. And it's the fact that we're still busy during these times. I have to watch my siblings, and one of my brothers suffers with autism, and like I have to help out with my family, because, you know, family matters also come. So it's putting family stresses with school stresses, and then that emotional stress of not having the support that we need. And I think that this is such an important issue to hit on. And one thing I hope to talk about later is just building connections that students can have, and making sure that we have the support that we need to make it through these times, just as anyone does. But I think there's a specific, unique experience that comes with being a teen during these times.
Thank you, Ariana. Indeed, and your program that you're involved in offers supports to students. Isn't that correct?
Yes.
Tell us a little bit more about that, please.
Yes, ma'am. So through, I'll start with Jared's Heart of Success. We hold wellness calls. At first, it was for our team to stay positive and keep working through these hard times. And then we opened them up to the community so that everybody could take part in this awesome training that we get from Alicia Gentile, who is our health coach. And it's really awesome. And everybody can come in and just learn how to take care of themselves during these times, which is something that I think is absolutely amazing. More things that we do is through Save Promise Clubs, and Sandy Hook Promise is not stopping because of COVID. And that's one thing I'm so proud of, is all the organizations I work with are not stopping. We're going to keep going. And so Start with Hello is something I'm very excited about. It's going to give students, with the part where I was talking about feeling lonely, it's going to allow students to make some great friends, just as they had been before COVID. But at least they'll have people now during this time, which I think is absolutely amazing. So those are just some of the things that my chapters have been doing, and I think that's just awesome.
Thank you, Ariana. That is indeed awesome. Let me switch gears a little bit and move over to Amy and talk a little bit about the fact that you and your MHA affiliate, Mental Health Association in New York State, passed that first statewide law that required mental health education in schools. In fact, we hold it up as a national model. And what can you tell us about how that policy change was so important and what you've been learning as it's being implemented in New York State?
Okay, sure, absolutely. It's interesting. We first started having these conversations about 10 years ago, and I don't think we could have ever imagined that we would sort of be in this environment where we are now. And so when I heard Ariana talking about the stress that students are feeling and the loneliness, and I think it was more important than we ever could have imagined, especially given the current climate. But we have been working to end stigma and discrimination and promote mental health and wellness and recovery for many, many years. And some of the research that had come out in mental health literacy had really kind of guided our advocacy efforts. And if people have taken mental health first aid or youth mental health first aid, they're familiar with that program. That is also based in mental health literacy research. And essentially what that research tells us is that if we had a better understanding about mental health, better understanding of the coping strategies we can use to keep ourselves well, better understanding of risk and protective factors, people are able to get the help that they need sooner. And when you look at the statistics among youth mental health challenges, and the fact that it often takes between 8 and 10 years for people to get connected to the help that they need, it seemed like a very natural fit. Like, we have students, we kind of have a captured audience, students taking health classes. They're already learning about substance misuse prevention. They're already learning about healthy coping skills to keep their physical health well and maintain physical health. And knowing the interaction or the relationship between physical health and mental health, it only makes sense that we be teaching them those mental health strategies as well. So that's really where that came from. And what we learned was that many health teachers were already teaching students about mental health. It's hard to talk about relationships or your physical health or sleep or substance misuse without talking about mental health. So it was naturally happening. And I think what the law did was it provided an opportunity to elevate the conversation about mental health within the school systems. And, even to bring it down to that kindergarten level, which it's very relatable when you think about social emotional learning and social emotional development. It's very similar. They're learning those kinds of coping strategies and self-awareness. So it really felt like a very natural fit. And that's really what we've learned the last couple of years, is that it's happening, and this just gives it more attention, I think.
Amy, what would you recommend to policymakers in other states from the things that you've learned in New York and the things that you saw that helped you implement the law?
I think first start looking at what are the existing opportunities to bring mental health into the conversation in schools. So some states have regulations around social emotional learning, so it makes it a very good fit. You could talk about it as part of physical health class. So just being aware of what the existing regulations are so that you can kind of create an opportunity. But I think the other piece is it really was important for us to involve our state office of mental health, to build relationships with our state office of mental health, our state education department, stakeholders, education professionals across the state. We have a great working relationship with the New York State School Counselors Association, school social workers, administrators. Everyone wants for sort of the same goals, is that students are well and that they can learn and that they feel safe and that they feel connected. So it was really important that we have those conversations and build those relationships. Also, our affiliates were an amazing kind of asset to our work, because they understand at the local level the needs of the communities and the opportunities that exist there to work with schools.
Super. Well, we've heard about how students are helping each other, how students are learning in school. Let's hear a little bit from Dr. Wakefield about access when kids need mental health services. Tell us about the programs that Texas lawmakers created to provide telehealth in schools, and particularly around the needs of students of color who ordinarily might not be able to access services.
Well, thank you. It's really exciting to get to talk about this. Texas lawmakers, our legislators really wanted to do something big and bold to address children's mental health and to help families with access to mental health care across our state. So the 86th legislature dedicated almost $100 million to improve children's mental health care across our state. Now, these were for several different programs, all of which had either a model within our state or a national model, and one of which is our school-based telehealth program and telemental health program. We are the program called Texas Child Healthcare Access Through Telemedicine, or TCHAT is the acronym. Will be administered, it's being developed and administered through our health-related institutions, through the departments of psychiatry at our medical schools and health sciences centers across the state. And what this does is actually also improve the education to our psychiatry residents, our child and adolescent psychiatry fellows, and our medical students about this type of care and access issues and how to deliver this efficient and effective modality of care. And telemedicine is increasing, and it is something that has allowed us out here in West Texas to really get care out to the schools where they need it. We have actually had a program out here at Texas Tech Health Sciences Center in Lubbock since 2013. Our Rural and Community Health Institute, under the direction of Dr. Billy Phillips, developed a program in response or with some to the concerns about children's mental health and students' mental health and some of the things that were going on around the country. And so in 2013, developed this program to say, how can we get schools access to assessments more quickly? How can we help support schools when they're concerned about a student and there are signs that the student may be having struggles or is at risk for being a danger to themselves or others, or just really struggling at school, maybe not showing up again, truancy, those types of things. And so we started where our LPCs, our case managers or licensed professionals, will go to the school and have a formalized assessment with the school with the parents' consent. And then bring that information back and triage with a child psychiatrist, so that and that happens within a week, where a child psychiatrist can hear the case presented by a mental health professional and very quickly say, this really sounds like something that needs to be seen by a child psychiatrist right now, or this sounds like this child needs a certain therapy modality or a school-based intervention, and then provides that feedback back to the school. If the child needs telehealth, if the child is deemed to need a child psychiatry appointment, then that appointment is done via telehealth, where the child stays at the school and the parent comes to the school. So when the student doesn't have to leave school, this really reduces the time that they're outside of school. It reduces the travel time for the parent. And actually increases the interaction. Now, this is all if the parent and student want to share what's going on with the school professionals. It's still, we maintain privacy, but if they do, then that's very easy to do in that environment. They can bring the school counselor in. We can share what's going on with the kiddo and really help the whole environment support the student in a more effective and efficient and earlier way. I don't know if you've ever tried to play phone tag with a teacher or administrator if you're seeing a child in your office, but we're all very, very busy, and it can take weeks sometimes to make contact. So even when the parent wants you to do that and the student wants you to do it, and you know that it will benefit them. So this is something that is facilitated much more quickly, and we can help the student where they are. So that is basically our model. We've actually, and the model that the state has taken on to roll out across the state from different health-related institutions as well. In addition, we have an echo-based project out here in West Texas that we're also talking about rolling out statewide in conjunction with other health-related institutions, where administrators or counselors, usually it's school counselors or teachers, could present a de-identified, no identifiers, but just a general case, a general, I saw the student struggling, here's what's going on, how do you think I could help them, and try to prevent actually the need for referral for a greater assessment or referral to a child psychiatrist, and see if we can intervene even earlier. The goal is to keep that child, keep that student in their school environment, and to not have a need for escalation of services if at all possible. But when there is a need, to have those services available as soon as possible.
That's wonderful, Dr. Wakefield. You just touched on one of the most important things that we think about at Mental Health America. Before stage 4, we intervene as early as we possibly can and before crisis. Tell us a little bit more about what the program costs and what the outcomes are, and what you're seeing. Obviously, it's helping kids and parents. You're educating the school personnel as well. Tell us a little bit more about that nitty-gritty, please.
Well, I think so. It's a little bit different the way this is being rolled out across the state, because the budgets are different based on which health-related institution is doing it and what way they're doing it and how many schools they're reaching. And so I think we'll have more information on the cost of a statewide cost by the end of this fiscal year, maybe the end of the next fiscal year. Like I said, the legislature dedicated $100 million to children's mental health for 5 different projects, and this is one project. We know that it is unlikely that we can serve every school across the state of Texas with this amount of money, but what we wanted to do was serve the schools that we have relationships with and even expand it past that to see how much it costs per student, and if we can roll this out for every school statewide. The echo-based project is much less expensive than having a child psychiatrist available, during school hours and enough child psychiatry capacity for all of the students who might need to be referred, and even to have the licensed professional counselors available to go to the school or respond to the school as soon as they call. So that is a model that we're doing right now. But we are very hopeful that actually the echo-based project will decrease the number of referrals that would be made to that program, to the program that we're doing. And then in conjunction, they provide a continuum of services. So I think that the jury is out, that there are ways that we can actually reduce costs. When you're starting programs, they always cost more than they have to cost, because you're projecting things and you're building things and you're building relationships and seeing what technology is necessary. We know in some parts of our state that we don't have the broadband infrastructure that we need, and so assessing those capacities is very important. But I do think that over the next 2 years, we will have a lot more information about what it costs to provide this continuum of services and how much the echo-based project can actually decrease the overall cost and improve care for our entire community.
Thank you, Dr. Wakefield. I want to ask Amy, I want to follow up on some of the things that Dr. Wakefield talked about in terms of serving a diversity of students. New York State is an extraordinarily diverse state. You have, one of the biggest urban areas in the country in New York City. You have very rural areas in Western New York and a little bit of everything in between. How do you ensure that as curriculum is rolled out across the state, it meets the diverse needs of students and it takes that into account?
I think the first thing which has been really beneficial is that the law was not written to require schools to teach any particular curriculum. It was up to the schools to identify which curriculum they would like to use. There were some recommendations and a framework that was provided for schools. So that was key. For us, from the perspective of our resource center, we're funded through New York State legislature and executive. So it was really important to us that we find a way to meet the needs of the entire state. And as you said, we're a very diverse state. I think I mentioned before the importance of relationships with stakeholder membership organizations. That was really helpful because that gave us connections to lots of people from across the state. Our affiliates are a great resource because they understand and know their communities. So really leveraging communities was important. Making sure that when we were working with a school, they had an understanding of their own demographics and as well as the resources that are available in the community to help them. But I think that the other piece is really leveraging the voice of the people we serve. And that's why I think it's so wonderful that Ariana is on this call, because we need to hear from the youth. We need to hear from staff. We need to hear from communities to say, this is our needs, this is our perspective, these are our experiences. So when you listen to the people you're serving, you can better meet the needs of the people you're serving, regardless of where they are.
Thank you, Amy. That leads right into the next question for Ariana. So thank you so much for that. Talking about students' role here. How do the students, Ariana, how do they come into, you talked a little bit about the programs and how that helps provide support for other students, but what do you think students can do to help educate each other? And what do you think the school administration and policymakers can do to help that happen?
Yes, I think that as students, we know what each other are going through, and we go through the same experiences. Although they are different in some ways, at the end of the day, we go through the same things. So it's our job to make sure that we're doing okay, because we can't expect older generations to always understand what we're going through, because of course we're different. So we have to make sure that we're there for each other, that we can support each other during when we're going through something, because again, we're going through something unique. Of course, COVID is unique, but I think the overall adolescent experience is something that is quite different from the rest of your life. So I think the best thing that students can do is for example, the Stand Up Act, which allows students to be able to be trained in suicide prevention and then use those skills to keep their peers mentally healthy, so that, if they're going through something, they have those supports. And that's where the connections part comes in my opinion. So I just think being there, and then also support groups is another great way to get students the support that they need, and students can do that on their own. For example, the wellness calls, that was something me and my chapter came up with, and our administrator just helped us put in motion. So I'm so happy to just let students know that yes, there are ways that you can help this cause. So my main two takeaways are: make support groups for you and your friends, and also just be the leader you are and get out there in the communities and just let your light shine. Yes. So yes, thank you.
Thank you, Ariana. That was wonderful. You are a tremendous advocate. How would you encourage other kids to do the kinds of things that you're doing in terms of advocating? I never take off my advocacy hat. So what do you say to your peers about how they can get other people as interested and passionate and excited as you are?
Yes. So for other people that are interested in this kind of thing, my first recommendation is just to find a group of people who are like-minded. That's how I got into this, and I'm so happy that I did. Just find people who have the same kind of mindset in your community. And I know that that's not an option for everybody. So my second piece of advice is be your own advocate. And this is something I do on my own time, on your own social media, just post what you feel people need to know and what you feel about things that are affecting your life and are affecting people around you. So be your own advocate, and the right people will come to you. Great organizations will follow you, and you'll just start getting involved and seep your hands into what advocacy really is, the nitty-gritty of this amazingness. So I would either recommend joining a group or getting those people to come to you through self-advocacy. So yes, I think that's awesome.
Thank you. Amy, any advocacy tips for our fellow affiliates and our fellow folks out there in the world to get some terrific legislation like you have in New York?
Well, I think what I was thinking about as Ariana was talking is we have a legislative advocacy day that we host every year, and the last couple of years we've had the opportunity to engage school groups. Last year we were expecting 750, or this year in March we were expecting 750 people, students from about 25 different schools, and unfortunately we had to cancel that. But I think that we need to give young people an opportunity to raise their voice and leverage their voice. So I think that's really important.